Okay, I think we're set. Okay, well, thanks everyone for being here. I'm happy to be joined by Senator Gillibrand, Senator Hassan, and Senator Van Hollen. I wanted to give you a sense of some of the feedback that I've been getting from constituents in Pennsylvania. Last night we had a call with AARP of Pennsylvania, and on that call it was evident to me how concerned people are about what the Republicans have or what they're cooking up in their secretive meetings. I don't even know where they're meeting. Maybe I'll find that out somehow. We can stake it out. But last night, for example, Fred from Morrisville, Pennsylvania, told me that that he's scared because his premiums will go up under the Republican health care proposal. I've referred to it as a scheme. You can pick your word. But we know that AARP estimates that adults age 60 and over could see their premiums increase an average of $3,200 because of the age tax. Because of this tax and the reduction in premium assistance, the Congressional Budget Office estimates that under the Republican plan, a 64-year-old earning $26,500 would see a net increase in premium of $1,700 per year under current law to go to somewhere between $13,000 and $16,000 per year. I don't know how anyone can deal with that. Another constituent of mine from Pennsylvania told us that she's concerned because she lost her job after 30 years working at the same company, relies upon Medicaid for her coverage. She knows about the cutback that will be in the Republican bill, because we know that the House bill cut Medicaid by some $834 billion. We're told by Senator Cornyn that the House bill, or the Senate bill, will be 80% of the House bill. So even I can do the math on that in terms of the cuts and the adverse impact. So we're grateful today to be joined by my colleagues, and also grateful to be joined by Susan Flashman. Susan will come after our remarks, but Susan's from Mount Rainier, Maryland, Senator Van Hollen's constituent. At the age of 57, she needed brain surgery due to a cyst that turned into a tumor. Her hospital bills were more than $100,000 at that time, and she's on Medicare now, and she'll tell her story about what this legislation means to her, and of course what it means to individuals and families like hers. So next we'll hear from Senator Gillibrand.
Thank you, Senator Casey, for your leadership and passion. Thank you to my colleagues. Thank you for telling your story. It really matters. And for each of us here, we are here to fight for our constituents. As everyone here is aware, just a few weeks ago, the House of Representatives passed a bill on a bitterly partisan vote that would take away health care for up to 23 million Americans. And there's no doubt that if this bill actually passes and becomes law, that Americans over the age of 50 would be among the worst off. If you're over 50 but too young for Medicare, this bill would give insurance companies the green light to start charging you 5 times as much as is charged for younger Americans, and it doesn't stop there. States could be allowed to tell insurance companies to ignore that limit and charge even more. That's an age tax, plain and simple. In fact, yesterday the Trump administration even admitted that it was an age tax. President Trump's own actuary announced that hundreds of thousands of older Americans will lose coverage under the American Health Care Act because of the age tax. We can't let this happen. The health care bill that has come over to the Senate, and a small group of Republican senators are working on it now. Many people have been asking me what's in the Senate's health care bill because they want to know if there's anything in there they have to worry about, including the age tax. And I'm wondering the same thing, because unfortunately, I don't know what's in the bill. Our colleagues who are working in secret right now seem to have a disturbing lack of interest in transparency, even for a major health care bill that will affect millions of people's lives in this country. It's outrageous that this bill is being negotiated behind closed doors with no public input. This is why we are here. We are elected to serve, to represent the people in our states. We should have nothing to hide, especially when it comes to legislation that is literally life and death for millions of Americans. So I urge everyone here, including Susan, to keep speaking out against this awful piece of legislation and demand transparency from Congress. It's the only way that we will change the outcome. It's the only way to make a difference, is if all of us keep raising our voices, being heard, and speaking out, and saying that we will not accept this bill. Do not give up. I now like to introduce Senator Hassan, who's been a champion on this issue, not only as senator, but as governor before that.
Thank you very much, Senator Gillibrand, for your leadership and passion, and Senator Casey for convening us today. To my colleague, Senator Van Hollen, and Susan, thank you for being here as well. And a thank you to all of the advocates who have been speaking up and will continue to speak up, and an invitation to all of advocates out there, all citizens, to speak up about what is happening right now. Senate Republicans right now are drafting Trump care legislation behind closed doors. And the secrecy behind the bill really shows that they know they can't defend it to their constituents. We know that this legislation will be very similar to the House Trump care bill, which President Trump himself called mean. And calling it mean is frankly putting it lightly. Trump care threatens to have devastating impacts for millions of Americans, including our nation's seniors. I have heard so many stories from the people of New Hampshire who are worried about the effects that Trump care would have on their lives and the lives of their loved ones. This month I visited the Coos County Nursing Hospital up in the northern part of our state. You know, the building there is old. It was built in 1932. But the care that people receive there and the kindness with which the staff works there is extraordinary. I met with several employees and those who have loved ones in the nursing home. One of those people was a nurse in the facility's dementia and special care floor. She told me that both her mother and her grandmother live in this nursing home and get their care there. She mentioned how cuts to Medicaid or a change to block grant funding would be devastating for 3 generations of her family. Her story was moving, but sadly not unique at all. I heard it over and over again. The social worker at the nursing home told me the number of people there who had spent down their life savings paying first privately for their nursing home care and then turned to Medicaid when their life savings were gone. What happens to them, she asked me. It's clear that Trump care will have harmful impacts for seniors in nursing homes and older Granite Staters. Trump care changes Medicaid into a per capita cap system, which is just code words for massive cuts that would force states to choose between slashing benefits, reducing the number of people who get care, or perhaps both. Under Trump care, states will be faced with cutting services that children, people with disabilities, and seniors depend on. The majority of nursing home residents in New Hampshire are served by Medicaid. Trump care would also threaten services for seniors who receive at-home care, and it would limit the economic freedom of caregivers who end up primarily being women. So if we make these kind of Medicaid cuts, if nursing homes and community care are not available, it will fall to a generation of caregivers, people who might otherwise be in the workforce, many of them women, to take care of their loved ones. And these cuts to Medicaid are just one of the ways seniors would be hurt under this proposal. Trump care, as Senator Gillibrand mentioned, would create an age tax, letting plans charge older adults 5 times more than younger people. And if you are between the ages of 50 and 64, you would be especially hard hit by Trump care. According to the Nonpartisan Congressional Budget Office, Trump care means you could face 20% higher premiums in 2018, with especially high premium hikes for older Americans. And the AARP opposes Trump care because it would, and this is a quote, make health care less secure and less affordable. Seniors deserve to have the support they need in order to live high quality and healthy lives. and Trump care is clearly not the answer. I'll continue to stand with my colleagues to make clear how harmful Trump care would be for Americans from all walks of life. I urge people in New Hampshire and across the country to share their stories, call their representatives, and make clear that this truly mean bill is simply unacceptable. Thank you, and it's now my privilege to introduce Senator Van Hollen.
Thank you, Senator Hassan, for your passionate outspokenness in opposition to what will clearly be a disaster for American health care. Senator Casey, thank you for bringing us together and for your leadership. Senator Gillibrand, and to my friend and constituent, Susan Flashman, thank you for being here to tell the truth about what the impact of this legislation will be. There's a reason every single patient advocacy group in the country is against this legislation, from the American Cancer Society to the Diabetes Association, heart disease, chronic diseases. Every single patient advocacy group covering people with all different health circumstances and all different ages is against this legislation. And the AARP has been especially vocal because while this Republican Trump care plan will do damage across the board, it will do especially grave damage to seniors, people between the ages of 50 and 64. If you think about it, there's a reason the United States adopted Medicare many decades ago for people over 65. Why was that? It was because people over 65 years old could not get access to affordable care. Insurance companies were saying no. They were going bankrupt, having to pay their bills. So, of course, the next most vulnerable contingent of Americans are those older Americans who are not yet on Medicare, Americans between the ages of 50 and 64. They're more likely to have pre-existing conditions than anybody else. You know, we've been around longer. And we're more likely to have risks of healthcare challenges and problems that need taking care of. And so what the Republican plan does is undo many of the protections we put in place in the Affordable Care Act. The Affordable Care Act helped address, didn't eliminate, but helped address many of those vulnerabilities for older Americans. And what Trump Care does and what the Republican plan does is strip away those protections, starting with the age tax, right? You know, again, the reason we have Medicare is because that was happening to people over 65. Under this Republican bill, those between 50 and 64 are going to pay massively higher premiums, which will make it unaffordable and either result in no coverage or bankruptcy for people because they just can't pay the bills. Secondly, the potential elimination of essential health benefits is also going to have a disproportionate impact on older Americans. All those protected areas are areas that are more used by older Americans than other Americans. And of course, as I indicated, pre-existing conditions, eliminating the protection against discrimination for pre-existing conditions will also have that impact. And as Senator Hassan said, people sometimes forget that when it comes to Medicaid, 2/3 of the money spent in Medicaid is spent for older Americans, Americans in nursing homes, and for individuals with disabilities. And so make no mistake, this Trump Care bill targets everybody, but it has a special target on the backs of older Americans. And we need to fight this tooth and nail. If the Republicans were proud of what they were doing, they would be telling the world about what was in their bill. The fact that they're keeping it behind closed doors tells you that they don't want anyone to see what's in there. They want to spring it on people at the last minute because they know if people have a chance to get a good look at it, then they will reject it, as they rejected the House bill in terms of the public support only being about 17%. So what we can do now is be as outspoken as possible as they're hiding behind closed doors, and let them know we want to see the bill, and we want it to be a bill that's good for all Americans. And I'm really pleased to have Susan Flashman here as an example of why it's so important for people to be speaking out.
Good morning. My name is Susan Flashman, and I'm a retired union electrician. And I am here today on behalf of the Alliance for Retired Americans. I am 63 years old, and my husband and I live in Mount Rainier, Maryland. I worked for more than 25 years, but when I needed brain surgery due to a cyst that turned into a tumor, it took about a year of rehab for me to be somewhat functional again. However, my balance was permanently affected and I was unable to work again. This happened when I was 57 and had been planning to keep working for a while longer. The financial effects compounded the worries I had about my health. The hospital bills alone were more than $100,000, and that was on top of the lost earnings. I had surgery in 2011. It was not until 2013 that my doctors and the Social Security Administration considered me permanently disabled, and I was able to get Social Security disability insurance. At that point, I qualified for Medicare because I'd already been out for 2 years. My doctors realized that I had plateaued my rehab and that my balance would unfortunately prevent me from working again. In a way, I'm lucky. I had a private health insurance through my union. If I had been left trying to get a new policy in the insurance market with this new legislation, I would have been financially ruined. As a 57-year-old woman with a brain tumor as a pre-existing condition, insurance would not have been affordable for me. We don't know exactly what Senate Republicans are planning to do to our health care because it is being done secretly. But older Americans know enough to be extremely frightened. We know the starting point for their bill is an American Health Care Act passed by the House. With the age tax that is contained in the bill, Americans 50 to 64, of which I'm one, will have to pay 5 times more for coverage than younger people, and it might even be higher than that in some states. Currently, we cannot pay more than 3 times what a younger person pays. Premiums for 60 to 64-year-olds would increase an average of $3,200, amounting to average unsubsidized premiums of almost $18,000 a year. Even if the Senate keeps in place the prohibition against discrimination for pre-existing conditions, if I lived in a state that waived the essential health benefits, I could still end up with a policy that does not cover my tumor. Luckily, Maryland does cover it. Thank you all very much for your time and consideration today. Thank you.
Susan, thanks very much. We'll take questions now. Sir?
Dick Missile from the Alliance for Retired Americans. Can we change the tag for the American Health Care Act to the Trump No Care Act?
You are free to do whatever you want on that. We're always open to suggestion.
Senator, what kind of time frame are you hearing from the folks on the other side of the aisle? Are you getting a better idea? I know there's talk maybe by Thursday, and if then, what kind of time frame would you be looking for?
I know there's a story around today that maybe on Thursday they'll inform their own members. That would be a matter of substantial progress, that their own members would finally know what was in the bill. But that is in no way an act of transparency. We need to have everyone know what's in it, not just take a small secretive meeting, at last count only men, by the way, and then enlarge that into a one-party secretive meeting. That's not great progress. So I hope they do better than that.
And I'd add that we we also need feedback from the American people and stakeholders about what the actual bill would do. You know, I come from a state that, although it has a very large citizen legislature, provides a hearing for every single bill that is introduced by a legislator. And you can't vote on a bill that hasn't had a hearing. And it is beyond me how a bill that would reportedly, if it's like the Trump Care bill that passed the House, take health insurance away from over 20 million Americans, raise premiums by 20% in 2018, and affect a sixth of our economy, how that bill doesn't get a hearing is just something I can't explain to the people back home.
Yeah, just to emphasize that, I think that really Republicans and Democrats should be in a hearing room together,
Right.
hearing from Susan Flashman and others who are impacted by the legislation. It is outrageous that they don't want to hear from their constituents who are going to be impacted by this massive legislation. And as Senator Hassan and others have said, you know, reminded people that Trump, after popping the champagne in the Rose Garden celebrating the House bill, admitted behind closed doors that it was, quote, mean. It is rotten to its core, and it's pretty clear the Senate bill is going to be an attempt to put a little cosmetics on it, and sell it as something that's good for the American public. If you want to sell it, have hearings,
Right.
right? Invite the American public to testify and let people know what the impact will be. Yes?
What kind of action do you recommend for those of us who live in states like Maryland who have representatives who were very much on board with this to make our voices heard?
I'll defer to my colleague from Maryland on that.
Well, I
I'll
do
answer
think, and I do believe that it's important that you work through your alliances and other organizations to reach senators in all the other states. And it's been widely reported that there are about 10 Republican senators who are on the Make Up Their Minds list. I urge you and your organizations to get a hold of those lists, and through your organizations, whether it's the Alliance for Retired Americans, whether it's AARP, whoever else it is, they need to be hearing from people in their state, and they need to be hearing now and nonstop.
And I would add, as a former governor, if your governor hasn't spoken up about this bill, what this bill in terms of Medicaid cuts would do to state budgets is extraordinary. And it's going to put governors and state legislatures in the position of having to decide who gets care under this cap Medicaid service, or they're going to have to increase their own budgets to a very large degree. So I would make sure that you're reaching out to governors and state legislators, again in both parties, but especially if they are Republicans, to talk with their colleagues in the Senate, because this has a huge impact on the bottom line of state budgets.
I agree with all that. Yes, sure.
One of the things that I did, and what I'm trying to tell people to do, is you have friends and families who don't live here. We all have families spread across the country. You need to tell them to call their senators and tell them firsthand, because they'll listen to their constituents. They have to. That's the only thing we have going for us.
Good advice. Maybe we'll do one more? Yeah.
Question about whether or not Senate Democrats are planning on performing any more actions like his speeches last night before the vote coming up.
Oh, we have a lot more to do in the next week and a half because we view this period as critical between now and the end of next week because, and I'm going to assume that the Republicans are on their way to passing a bill. We have to assume the worst case scenario, which is they're going to get the votes to pass it, and we've got to try to stop that from happening. So we've got a lot more work to do in terms of advocacy, in terms of having more floor speeches and more meetings, more outreach. And I'll tell you, as much as we can do here, the organizations represented in this room and in rooms like it can do a lot more. Your voices in many ways will be more persuasive than ours. I said that earlier to Susan, I wasn't just kidding. That's actually the truth. And what's happened, I think, in a short period of time is you've had organizations like those that Senator Van Hollen mentioned have amplified their voices to such an extent that I think Republicans are starting to hear that now. So if anything, whatever we do, whatever intensification we bring to this argument, we've got to make sure that groups around the country are doing likewise, because on the ground back home, AARP and groups like it are going to be much more persuasive. We're going to continue to work on it here, though. Okay, thanks everybody.